First, we will measure the patient's blood pressure using a sphygmomanometer and a stethoscope. The procedure is as follows. When positioning the patient, ensure the patient is seated comfortably with their arm at heart level, resting on a table. The arm should be supported with the palm facing upward. Wrap the cuff around the upper arm about an inch above the bend of the elbow, making sure it fits snugly but not too tight. Place the stethoscope's diaphragm over the brachial artery just below the cuff's edge. Inflate the cuff until the gauge reads above the expected systolic pressure. Slowly release the air from the cuff while listening for the first sound and the last sound. The first beat heard is the systolic pressure, and when the beat disappears, that is the diastolic pressure. Record the blood pressure reading, noting the systolic over the diastolic pressure. For the body temperature, we will measure it through the patient's axillary site. To begin, open the digital thermometer and clean it using cotton with alcohol from tip to stem in circular motion. Inform the patient to lift their sleeves in order to place the thermometer in their armpit. Check the area if it is sweating, if there are any lesions or scars. If sweating, pat it dry using cotton or tissues. Place the tip of the thermometer at the center of the armpit. Then, put the hand of the patient on the opposite shoulder to secure the thermometer. Wait until the thermometer beeps, indicating the data is already obtained.
Next, we will measure the patient's pulse rate. Locate the pulse. Place 2 fingers, the index and the middle finger, on the patient's carotid artery, which is located on either side of the patient's neck.
After the thermometer beeps, remove it, then inform the patient the results. Disinfect the thermometer from stem to tip. Then document the data gathered.
Then we proceed for the height measurement. Tell the patient to remove his shoes or slippers and stand straight with back against the wall. Use any flat surface objects to measure the patient's height, then we record it.
Finally, we will measure the patient's weight using a weighing scale. Step onto the center of the scale, standing still. Record the weight. We read and record the weight of the patient accurately, ensuring the value is noted in kilogram or pounds, depending on the scale. So that concludes our demonstration on taking vital signs. It is important to follow these steps carefully to ensure accurate readings. Thank you.
The first step in donning PPE is to perform hand hygiene. In performing hand hygiene, wash your hands thoroughly with soap and with a surgical brush. Turn on or off water with the elbow. During washing, keep the hands away from the clothing and higher than the elbow so that the water drains away from the hands. Make sure to cover all surfaces of your hands and fingers, rubbing each surfaces by 10 strokes at least. On the forearm up to the elbow, brush 10 strokes for each side with one direction only and repeat it on the other side as well. On washing away the soap, Make sure to keep arms bent with the hands higher than the elbows so that the water runs away from the hand and moves slowly. Then dry with a dry, sterile towel just by patting. Next, we'll put on the gown. Pick up the gown by the shoulders, allowing it to unfold without touching the outside. Carefully place it on by slipping your arms into the sleeves, ensuring the gown covers your body fully. Then, secure the gown by tying the neck and waist straps. Then, we'll don the gloves. Take the gloves and put them on, making sure they extend over the cuffs of the gown to cover the wrists. Taking off PPE. When removing PPE, we follow a specific order to avoid contamination. Let's begin with removing the gloves. Pinch the outside of one glove at the wrist, carefully peeling it away from your hand and turning it inside out. Hold the removed glove in your opposite hand, then slide a finger under the wrist of the remaining glove and peel it off over the first glove. Dispose of gloves immediately in a designated waste bin. Next, we'll remove the gown. Untie the gown at the neck and waist. Grasp the gown at the inside of the neck or back and pull it away from the body, being careful not to touch the outside. Roll the gown up inside out and dispose of it properly. Then, lastly, we'll perform hand hygiene again before proceeding. The first step in donning PPE is to perform hand hygiene. In performing hand hygiene, wash your hands thoroughly with soap and with a surgical brush. Turn on or off water with the elbow. During washing, keep the hands away from the clothing and higher than the elbow so that the water drains away from the hands. Make sure to cover all surfaces of your hands and fingers, rubbing each surfaces by 10 strokes at least. On the forearm up to the elbow, brush 10 strokes for each side with one direction only and repeat it on the other side as well. On washing away the soap, make sure to keep arms bent with the hands higher than the elbows so that the water runs away from the hand and moves slowly. Then dry with a dry sterile towel just by patting.